Hello, I'm your host, Neal Howard. Thank you for tuning into the program today here on Health Professional Radio. Thank you so much. Now, although there are numerous resources available to the approximately 82,000 men, women, and children who experience homelessness in the Los Angeles County area on any given night, many of these folks simply are unaware of these resources. Our guest is Dr. Clemens Hong. He's here to talk about the Whole Person Care Program as director of that program and as medical director of the Community Health Improvement at Los Angeles County Department of Health Services. Welcome to the program, Dr. Hong.
Thank you for having me.
Thank you. We're here to talk about this new Whole Person Care Program. What is it and why was it created?
So the Whole Person Care pilot program is a part of the 1115 Medicaid waiver, which is a contract that the state of California signs with the Center for Medicaid and Medicare Services to provide Medicaid services here in California. And a part of this was a pilot program that they put into place to take care of some of the sickest and most vulnerable residents at the county level. So the funds are provided to county to serve a subset of the highest risk individuals that we serve in our county, individuals who are homeless. In our case in Los Angeles, those who may be justice involved, who suffer from serious mental illness, substance use disorder, or significant medical illness. And so this group of individuals, through the Whole Person Care pilot, have an opportunity for additional services that many would put in the sphere of care management or care coordination services. So individuals that work with them on a day-to-day basis to really help them receive the services that they need to improve their health and eventually to thrive within LA County. So it's a program that really sort of encompasses the totality of need that these individuals face and tries to sort of connect them to the services that they need.
Now, I mentioned an approximate number of 82,000, I guess, give or take a few thousand or whatnot, men, women, and children. Are we talking about providing services to these individuals only if they're homeless or if they have a place to live, maybe in a shelter or some other type of facility, but they still have these mental conditions, these drug or substance abuse problems? What are some of the criteria? Or is it simply that you have to be in need in order to benefit from this pilot program?
So many of the things that we sort of look at in terms of eligibility across our now 16 programs are variable. So we really look at individuals who are really touching many parts of our public delivery system, either the healthcare side or our county jails and the health services within them, our mental health treatment facilities. And what we try to do is identify individuals that really are using these services in ways that may be sort of less than ideal for them, and try to really connect them to the different services that they need. And so it isn't specifically housing that we're sort of, or individuals who are homeless. We do have a series of programs for homeless, high-risk individuals, but we have similar programs for individuals who are justice involved who may not be homeless, or individuals who have serious mental illness or substance use disorder, or that are leaving our hospitals with medical conditions. And so there's a series of different criteria that we use to determine entry. But what I would say is that for the most part, these are individuals that use our services in ways that some may consider sort of excessive, or in ways that may be less than ideal in terms of achieving health for them.
Are these medical services and other services, well, specifically the medical services, your program is called the Whole Person Care Program. Does that imply any integrative medicine or alternative medicines, or are we talking strictly healthcare as it is provided by traditional healthcare providers?
So I would say that, the work that we do is clearly partnered, and it's critical for us to be integrated with the traditional longitudinal care providers that are out there, because many of these individuals have needs across the spectrum of health and behavioral health in terms of the issues that they face. I think the whole person piece of it really sort of speaks towards an emphasis on addressing many of the social needs and behavioral needs of our clients, which often are not addressed in an integrated fashion with our more traditional healthcare system, our hospitals and our primary care clinics. So what we try to do is with these intensive care management teams, these individuals that really work closely with these individuals and see them maybe many times a week or have them on the phone many times a week, they're able to really sort of identify what their needs are, not just in the traditional physical health space, but also in the behavioral health space, and identify their social needs, such as housing or reentry to society, coming home from prison. And they're able to really work with them and meet them where they are and sort of walk them through the delivery system that is out there to serve them, as well as sort of walk them to really on their journey to health.
What is, would you say, the primary method of making contact with these individuals in order to let them know that there's these resources that they can take advantage of? I mean, do you have, for lack of a better term, a street team that goes to hospitals, mental facilities, jails, and shelters to identify these individuals? Or is there some type of outreach program, awareness program that they can become involved with to get this information? How do you make contact with people who are in need?
Yeah, so it's very dependent on program because of the entry points. However, we've really tried to take an any door approach to the entry into programs for individuals who qualify. And so based on our eligibility criteria, we have many different points of entry, and I'll give you a couple examples. So we have, starting in July here, a call referral line where people really from anywhere in the county, whether it be a neighborhood church or a mental health center or a primary care health center or an emergency department, can call in and make a referral based on the eligibility to whole person care programs and receive services if they're eligible. In addition to that, many of our programs really are place-based in that they seek to engage clients that really need these services in certain settings. And an example of that might be our county jails, right? So as people enter our county jails, we're trying to, as a part of their regular entry process into the jail, we're trying to screen individuals who may have a need for whole person care so that during their sort of stay, we can sort of address the needs that we expect them to face as they reenter and come home. Mm-hmm. And we can sort of connect them to resources at that point of care. And so jails would be another site. Another example that would be our psychiatric facilities, our hospitals, and our institutes of mental disease as another potential place where we're trying to actively identify these individuals and engage them and move them into the most appropriate situation and site of care for them.
So this is an extremely non-traditional outreach with these non-traditional types of patients. Do the same privacy guidelines apply when it comes to tracking these individuals, identifying them, getting the care to them that they need? And when that care, in the process of giving that care, you come across something that raises legal questions. We're talking about men, women, and children who are experiencing these situations. What type of a platform can you possibly be able to use to put all of that non-traditional information together in a useful fashion? Yeah,
so I think, this is where we have really done a lot of thinking and work with a partner of ours, which is Ecovia Solutions and their Client Track tool. It's a platform that we're trying to put on the ground here to really solve a lot of these I would say disintegration issues in the way that information and health information and is shared among different teams that are out there trying to provide coordinated care for these individuals, right? And so you have, and like you alluded to, these are not sort of the average clients that have, a handful of issues that can be addressed predominantly in one or two settings. These are individuals that often have multiple case managers working across multiple settings. And so this raises a need not only for information sharing, but also a place where perhaps something such as a care plan, which is a place where we're actively creating different activities and action steps that we're working with a client on can be shared and viewed so that multiple case managers and individuals that are involved in care can see what the status of any given application or set of services is. Like, for instance, if we wanted to refer someone to a food program like SNAP, and we could sort of follow the status of that on one platform so we don't have multiple case managers in three settings submitting that application, right? And so this is made possible in our system through a series of IT platforms, but one really critical piece is that front-end platform that we've contracted Ecovia Solutions for, which really allows us to sort of keep that care plan in one place and through a portal make that care plan accessible to others. And you alluded to some of the challenges in terms of data and sharing that data, and we've sort of put together a robust consent process here, working with our county council. And this process will all be managed with the support of this IT platform. And so I think that enables us to be able to share this data in the ways that we need to provide better care.
Now, where can healthcare professionals who are listening to the program go and get more information and find out how they can become involved in the program?
So within the County of Los Angeles, there are multiple sort of community engagement events that we've put on. We'll soon have a call referral line, and we have a communication strategy by which we'll sort of be engaging providers. But many local providers can go to their to the organizations that they sort of are members of, whether it be community clinics or hospital associations, and seek additional information. In terms of clients, there will be this call referral line as well that is up, and I think that will be a good point of access to most of the programs and services that we provide.
Well, I appreciate you coming in and speaking with us today, Dr. Hong. I'm hoping you'll come back and speak with us as the program progresses and talk about some of the results.
Would love to.
Thank you.
Thank you, Neal.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Clemens Hong. He's been speaking with us as the director of the Whole Person Care Program and medical director of the Community Health Improvement at Los Angeles County Department of Health Services. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud. See us on YouTube, like us, and follow us on Facebook, and visit our affiliates page when you visit hpr.fm.